it was a challenge, and I would be lying to say that it wasn't. I think as leaders, we're always challenged to grow, and so going from a system that I was fairly comfortable in to the unknown of this larger merged system, um, there was a lot more to consider, a lot more aspects to cover, new communities, various things, and it really was about how do I now reset and lead this team, and so we had to come together and work through that and figure out how we were going to function, even down to simple things of, in our legacy systems, there were different isolation signs and different colors meant different things. And so we had to even sit down and think, okay, do we want new colors? Do we want to stick with one color? Do we want to mix it up? And so simple things that you don't think of, we had to go through policy mergers and making sure re-educating an entire health system on, okay, contact isolation is now this color, and this is where you're going to look for it. And so simple things like that you really don't think of when you're thinking about mergers. As a leader in general, I think, from a nursing background, there's a whole aspect of how I was responsible for budgets for several hospitals and, you know, just all of those responsibilities. You don't really learn budgeting and forecasting in nursing school. And so that in and of itself has been a challenge. And then I think just really being able to lead and forward think. And I will say I'm very thankful that our health system invests in leadership training. I've been fortunate to attend several different programs, but really focusing on those leadership skills, because as IPs, I think we can frequently find ourselves in the weeds and we want to get in there and do the work. And sometimes we have to. Sometimes we absolutely have to be there and doing that day-to-day work. But what I try to do and what I've had to learn to do is trust my team, trust my managers that now report to me to bring me issues. And my job as the infection prevention officer now is to forward think, to make sure that our health system is prepared for whatever's coming, to really focus on all of those things like value-based purchasing and the things that impact us on hospital-acquired infections. And so I have to build a strong enough team to really step back a little bit from that day-to-day surveillance and focus on being an executive leader now.